We started a book project back in 2005 where we wrote a book entitled The Accidental Sisterhood. And the whole goal of the book was to educate women about bladder problems, pelvic floor problems, the things that can happen to them. The crux was to give women this education in a way that they could learn why these problems happen, learn conservative methods to prevent them and treat them, and then also all the other options that are available for them. A lot of women like the cover because it's pink. It was specifically designed that you could sit anywhere on a plane, read this book, and no one would know what you were reading about. Although the book is pink, there's nothing in the title that's going to say it's about incontinence or bladder control or prolapse or things falling down. As a urologist who treats females, who's done a fellowship in female urology or female pelvic medicine and reconstructive surgery, that's what I do all day. I treat women with these problems. The other reason for doing it was you can only see so many people in a day. And this really gave me the opportunity to reach out to thousands and thousands of women at a time. One of the symptoms a lot of patients will walk in with, and it's kind of funny, they know when they go to the mall, they know where all the nice bathrooms are at. They know that the grocery store may have a better bathroom than the clothing store, and they'll make sure they stop at all of them. One of the options certainly that we start with everybody is pelvic floor therapy, trying to strengthen the muscles and nerves in that pelvic floor area so that your bladder can regain more control. And as everyone's talked about, it's those Kegel exercises. And there's multiple ways of doing them. The other option are medications. We have probably 7 different medications now that give you better bladder control. And then if the medications aren't working, you can move on to something like interstim therapy. The party line for leakage is no leakage is normal. I mean, if everything's functioning properly, you shouldn't leak. Patients can have that urgency that we talked about, the going quickly, going more than 8 times a day, and the stress incontinence, the leaking when they cough, sneeze, lift. And for many patients, they have both. And so we really spend a lot of time getting patients to understand that there's a difference between the two and that there's 2 different treatment options, or 2 sets of treatment options, and you have to treat both. One thing the Sisterhood has really shown us is that women aren't alone with this problem. When we've had our forums, our events, we can get 400 women out within a matter of weeks of advertising an event. And women will talk about these things. At all the events we've done as we've traveled across the country, we've never had a problem finding women to stand up and share their story to 400 other women at the same time. So they're not alone. There's a lot of great websites out there now. Even on our website, we've started a chat to discuss things, and women will talk about things. The message from the book is that there's a lot of treatment options, and I think that's what's great. This disease state, bladder problems, prolapse, things are changing rapidly. We get new medications, new surgical therapies every day. I think the take home is be comfortable to talk about it. Look for those different options. Find that option that's the right option for you. And I think we have answers for people. There's ways to get bladder control back again.